Welcome to the Clinical Pharmacist podcast, where we discuss interesting topics related to clinical pharmacists in general practice. My name is Runa. I'm your host. I'm the clinical lead of CPS and the training and development manager of Clinical Pharmacist Academy. We also have Mahmud, our co-host.
My name is Mahmud Yusupov. I'm also a clinical pharmacist, independent prescriber. I'm the founder of Clinical Pharmacist Solutions, recruitment, training, and healthcare services provider that specializes in clinical pharmacists in GP surgeries.
We're delighted to be joined today by senior clinical pharmacist at Clinical Pharmacist Solutions, Adrian Murphy, who started his journey in this role around 18 months ago. Adrian, welcome.
Thank you very much. Thanks for having me.
I'm delighted to have you here with us today. So please start by introducing yourself to our audience.
Sure. My name is Adrian Murphy. I'm a senior clinical pharmacist here at CPS. I'm also involved in the training development team in the Clinical Pharmacist Academy. At the moment, I'm currently involved with running COVID vaccines. So obviously, as well as vaccinating or making up the Pfizer vaccines, what have you, I'm also helping clinic to actually manage it. Anything from organising the volunteers who run it, making sure we have enough vaccinators, enough admin staff, maybe looking at the actual supply of the vaccine. So yeah, kind of really involved in the nitty-gritty of the management as well as purely vaccinating people as well. So yeah, it's really different from anything I've done up to now. So it's really exciting, really rewarding, and obviously quite tiring as well.
I see. Yes, I can imagine. So let's take a step back for a moment. And if you can tell us how you got into pharmacy and then, how you got into the clinical pharmacist role as well. So tell us what your journey looked like when you started.
I've always been interested in science, so I'm kind of like a scientist at heart. So I was really into biology and chemistry at school. I think I was always kind of destined to go down some kind of healthcare route. And then it was just a case of deciding on which one. It was between physiotherapy or pharmacy. And then in the end, I decided from everything I kind of spoke to pharmacists, physios, and I decided that kind of pharmacy sounded like it would be good for me. So then I traveled all the way to Scotland, and I really enjoyed my 4 years at the Robert Gordon University. Kind of learned, met lots of really good friends, learned loads. Then obviously it was a case of what did I want to do? So I kind of, at the time, I think the obvious choice was kind of community. So then I kind of then went all the way to Essex, did my pre-reg, and then from there spent 8 years with Boots, kind of in the community side. During that time, I kind of realized I really liked the clinical side more so than management. So the management, in general, didn't kind of excite me as much as kind of just getting into the nitty-gritty of speaking to people about their medicines, how they're getting on with their kind of hypertension, what have you. So once I saw that there was a really good opportunity to kind of come into GPs, it was certainly in the back of my mind anyway, without maybe me taking any action. So it's kind of main origin.
Yes. Okay. So Clinical Pharmacist Solutions is based in Essex. And that's how we met you and you joined our team. So can we talk specifically more about how you got into the clinical pharmacist role, how you transitioned and what allowed you to do that?
Yeah, of course. I mean, if I kind of quickly, before we get off in a tangent, for years kind of interested in, being stable financially. I've got myself, not like rich or anything, but I can at least just try and have like a bit of stability. So I've kind of made sure I've got myself in a position where I can survive for whatever amount of years without, if worse came to worse, I couldn't work. So I had that kind of built up before I even decided to go into GP practice. So once I was given the opportunity to join, at the time I was like, still a bit unsure, kind of worried as you would naturally be, will this be for me? So I didn't want to suddenly just dive in. So I just said, all right, I'll start with 1 day a week here. So I started to drop days of Boots, take like a day or two in GP practice. And then I think after a couple of months I realized that if I really wanted to really kind of progress as a clinical pharmacist in a GP surgery, I would have to really give myself that time for experience and have days to study, kind of, because I realized that I lost some of my clinical knowledge that I just hadn't used in community. So I kind of made kind of like a big decision for me at the time to leave Boots permanently and then pursue the pharmacy IP course, what have you. And obviously I had that kind of, even though obviously it was a scary thing to do, also I did have that kind of backup, knowing that like worst comes to worst, I had that financial security security to pursue it without getting distracted by any financial worries.
Yes. So I think what you're saying is, Adrian, before you were able to get started in this new role, it required you to cut down on, some days in your employed role as a community pharmacist for self-study, work experience in general practice. I guess there's an element of sacrifice involved in terms of the time that you need to put into pursuing this new role.
Days, of course, yes. It was reduced my income initially, but for me, I felt it was totally worth it.
Obviously, financial security can mean a lot of things. It's kind of broad term. Can you tell us more specifics in terms of how you achieved that?
Yeah, I think it's partly kind of improving your knowledge base. So, not at the same time, I wouldn't expect everyone to maybe delve into it as much as I did. But once I kind of got interested in the topic, I read various blogs, listened to podcasts, read books. I have a bookshelf, I think, and I realized I've got, when I counted yesterday, I've got like 19, 20 different books on the topic. So maybe obviously I've got.
Are you talking about stocks and
yeah, stocks? Yeah, so stocks and kind of everything from kind of like from personal finance. So that would be just maybe your income and expenditure to more advanced topics like actually investing your money in stocks, property, various things like that. Yeah, so I think it started maybe just as an interest in, you can make some money in stocks. And then I went on to, if you understand maybe what your expenses are for one, that's powerful. So you kind of know what you need on a month-to-month basis. And as well, you can break that down into maybe essential expenses. So obviously mortgage, food, a little bit of entertainment, shelter, then kind of go to your maybe slightly more lavish budget of like putting in holidays, other things like that. So if you know where you stand, and then you can and then you know what your savings are, you can kind of say, all right, so with this amount of savings, I could last X amount of months, X amount of years, what have you, kind of on that. And then obviously, then you learn to say, all right, now let me grow that amount that I have, my whatever your investment pile is. And then
Sorry to interrupt. You know how people don't really like to save because then they have to live kind of more frugal life?
Yeah.
Does that mean you kind of started slowly and then you realized that the benefits of having that security, and that gave you encouragement to save more and continue investing and grow your portfolio?
Exactly. I mean, I think you kind of, everyone has their own journey, this environment. For me, I think it started out first as a little bit of being interested in investing. Then I got into there's this movement called the FIRE movement, where the idea is you kind of go a bit mad, maybe save loads and then invest, and then you can have the option to retire or maybe just be financially independent, do what you want. Yeah, for me personally, it was a case of I kind of look after what I spend my money on, but I certainly don't feel deprived of anything. If I want something, I get it. But then at the same time, I think it's more not so much depriving yourself as much as just actually saying what gives you joy in life, spend money on that, and then just make sure you're not spending money on things that you're not using. If you're going to spend money on loads of clothes and you don't wear them, that's not good. But if there's something you enjoy, so if you enjoy something, by all means, spend on it. I think it's more about just finding out what makes things that make you happy. For me, it's like spending money on food and holidays. Not a big clothes person, or I don't have other lavish expenses. I know now what kind of makes me happy, what I'm happy to spend a bit more money on. But then so I feel deprived, but I'm still able to save.
So you've read 19 books, and you got to a stage where you feel comfortable. Yeah. Do you think the pharmacists who are listening to this podcast, can they get in touch with you and get a bit more insight and maybe your opinion or advice on how they can plan the journey if they want to, if they're interested to find out more?
Yeah, happy to kind of see if there's anything I can suggest.
Adrian, what was it like when you first started in terms of how you approach the work, considering your clinical knowledge base at the time?
For the first few months, what we did, agreement where obviously I would get paid, because what I was doing was kind of processing letters, doing prescription tasks and things. So maybe rather than getting paid per hour, the agreement would have been so X number of tasks, an hour's work, X number of letters processed equals an hour's work. So I think it took me a few months then to get up to then, all right, now I'm doing more than that, so now I get paid per hour. Some people could very well be quicker. That first few months, obviously, I was still doing quite a lot of work in community as well. So, certainly I think it makes sense to reduce, to kind of not worry too much about income if you are lucky enough to be in that position, to then really upskill yourself in terms of type of work you could do, and also then having that space to look up things, because like every day you're coming across so many different things that you may have not seen. So I think it's you really do need that time and space to really grow as a clinical pharmacist.
I see, yes. And just to give our audience an idea in terms of the number of tasks completed, I think most pharmacists starting out, because it's a completely different ballgame, isn't it? The language is so different. Starting out, I think when a pharmacist first starts, they probably, I don't know, might only complete 3 or 4 tasks in an hour, if that.
I think I was lucky. I think I remember originally we said something like normal pharmacists, and even this is probably slow anyway now, but like 12 tasks an hour. And I think that first day I was there for like 11 or like maybe 9 hours, and I think I just about did 12.
Yeah, and you could probably do easily 100 tasks a day now, I imagine.
Easily, yeah. Oh yeah. I know I've done like 150 in a day. So like once you again, like you will eventually start to see things that are similar and have that natural protocol in place. But you're always seeing a few new things. But at the same time, once you do get used to, certainly there will be certain similarities, and you'll get obviously more confident. Just navigating the systems and recognizing what's a normal blood test, and not having to look up as much each time. So it does all come together.
So I guess it eventually becomes repetitive, right?
Yeah.
Would you say 6 to 12 months, and then you kind of want to the next level and do something
Absolutely.
else?
So yeah, again, obviously it will depend on like maybe how much hours you're doing of the tasks as well. But yeah, certainly 12 months max. So yeah, even 6 months if you're doing a full, almost full time. And again, and obviously it will come down to your own personality. Like for me, I'm probably someone who wants to know everything almost before you start, which is probably not always feasible. But so I'm certainly definitely the cautious one. So yes. I like to know. I'd like to deep dive into each topic before I ever really see a patient. But yeah, again, maybe someone else may be a bit quicker. So I'm probably in the slower group anyway in terms of taking with my cautious nature.
I was going to say that's something that Mahmud and I noticed about you. Now, from our point of view, I think that's really good because you're really cautious, and because sometimes you do get the overconfident pharmacists who they think they know a subject, but actually they may not know it as well as they need to. And that's certainly one thing that we found with you, is that you really like to read into the subject quite at a deep level, make sure you understand it, and then by the end of it, you really do know what you're doing. So, and I commend you for that, and I think that's fantastic. And that's one of the other reasons why you are also the author of one of the training programs and clinical medication reviews in general practice. Can you just tell us a little bit about that, please, as well?
Yeah, so I think the origin of this medication reviews, the clinical ones, is true. Yeah, I think it's true experience. Obviously, I've had the fortune of working with you guys, and kind of any time I had any concerns, you'd kind of give me guidance of like, oh, this is what you should do for hypertension, for example, or this is what you should do for diabetes. And then I thought, see, there was a lot of pharmacists who may not be in that position, and I was thinking like if it was me personally, what information would I like to know from my community pharmacy days? Obviously, we have the medication use reviews, and obviously there was a certain amount of information you might use there, and I realized that obviously it was totally different once I went to general practice. There was a lot more in-depth knowledge things you needed to go into more for each disease. So for example, I like to use is if you're doing a clinical medication review for gout. So I think most people, if they're in the position of kind of reviewing a patient for gout, they will say, yeah, all right, how are you getting on with your gout? Have you had any attacks of gout? And they may know as well, all right, I'll look at the medication. Are you on allopurinol? All right, maybe I'll do the monitoring, the normal monitoring for allopurinol. So fair enough. And then they'll probably say, yeah, I'm happy with that. So, and then obviously that's probably what I would have thought before but obviously knowing me, I wanted to really get into the nitty gritty. So I kind of delved into the clinical knowledge summary for gout. And when I realized that kind of on top of monitoring the symptoms of an acute attack of gout or the general day-to-day issues someone might have, that you actually do need to do things like a cardiovascular risk assessment, because gout is a independent risk factor for cardiovascular disease. So particularly if someone is only on, for example, allopurinol, and they haven't really had a cardiovascular risk assessment, that is something that you should be doing at an annual review. Also, I mean, in general, you probably are looking at the renal function. You have to do kind of urea electrolyte and EGFR blood tests. But certainly it's kind of being mindful that, again, when you have gout, like that kind of renal disease is another risk factor. But then you may want to have in the back of your mind, all right, I need to actually really keep an eye on the kidney function, and then if need be, according to guidelines, whether they need kind of further renal tests like a urine ACR. It's a bit more in depth than just saying, oh, how are you getting on with your allopurinol? Okay, great.
Yes, absolutely. And many times when I've conducted medication reviews for gout and the patient may not necessarily be symptomatic, some of them question why they're still on allopurinol. And it's for that reason you explain that it's a cardiovascular risk factor and because the uric acid is above a certain level. And similarly, you also have some patients who are symptomatic but not on allopurinol and only treating recurrent flare-ups with NSAIDs, which is, of course, really putting them at risk.
That's it. Yeah, exactly. Yeah. So obviously, it's obvious, like for gout, that you'd look at maybe uric acid and obviously the monitoring for the drug, but then they may then not realize the kind of added thing of maybe just looking at the renal function in a bit more detail, potentially. Yes, the cardiovascular disease. And obviously, yeah, that's why we do this, obviously, for the pharmacists to get more out of their job, and obviously as well at the end of the day to protect patients, what we're here to do.
Yes, exactly. In our positions, we have a duty of care to our patients, and that's why it's so important to understand the condition we're dealing with at a deeper level rather than just a superficial understanding. And that's what enables us to make the right decisions and also educate the patients too, which is key. And I know we discussed about you taking a little bit of a pay cut initially as you were getting into the role because you needed, not only time out for self-study, but you also needed work experience as well. The roles available as a clinical pharmacist, they vary quite a lot. And so do the hourly rate varies greatly as well. So starting off as a clinical pharmacist, someone who has no experience, maybe Mahmud, you can touch upon this because you quite often conduct the interviews for pharmacists. You discuss the pay rates as well, don't you?
Yes, the pay rate ranges a lot, you're right. And it also depends whether it's an permanent employment role or whether it's a contractor or a locum type of role. But I think it's easier to mention locum roles with, level 2 pharmacists. The hourly rate ranges from 20 to 25, and then level 3 comes then 25 to 30 pounds an hour.
And just to jump in, a level 3 pharmacist is someone who is seeing patients, maybe running clinics as well, but not necessarily, they may not have an independent prescribing qualification.
Yeah, level 4 pharmacists who can run minor illness clinics. They've been, trained and have got experience. Then it goes 35 and above, and we can see some rates going up to £50 an hour with experience at the moment.
Okay, so Adrian, coming back to your role as a clinical pharmacist, can you tell us a little bit about what sort of roles did you carry out when you first started, and how has your role progressed over the years?
Of course. So in the very beginning, I started out processing letters, so anything kind of coming back from a consultant or what have you. So kind of maybe quite often it may not have been any actions. Other ones may have been maybe changing a medicine or kind of starting a medicine on the recommendation of consultant. Then as well progressed to doing discharge letters. It's kind of doing medicine optimization, and then obviously kind of went on as well to do tasks. So it would have been anything from reauthorizing repeat medication as well as the odd acute request. But obviously I did know that acute requests you had to be very careful. There's kind of a bit more risk involved compared to a repeat reauthorization. So I just want to throw that in there. Yeah, and then I started doing some medication reviews kind of later on. So that's maybe later. Yeah, so kind of then dived into medicine reviews, and actually at the moment I have been doing the SMRs, and obviously it's still day to day. You're always kind of going to have kind of tasks to do, but obviously they kind of get a bit more involved. So it might be more definitely just doing a kind of a discharge letter, or maybe you kind of maybe start dealing with the more kind of not awkward ones, but like the ones that require a bit more experience. So the acute requests, and then obviously ones where they might be less appropriate, where you'd have to speak to a patient, kind of seeing why are they taking a certain thing. Maybe, for example, why are they repeatedly requesting Zopiclone or something like that? Kind of want to be careful in those situations. So I've kind of got to the stage where doing the medicine reviews, SMRs, and also running certain clinics. So for example, at the moment, kind of competent to do the asthma ones, and obviously I was involved with your training as well. Kind of I feel like I was the beta tester for that.
Yeah.
I suppose at the moment, where I am, I can do, obviously if I went into any GP practice, I'd be happy to do their letters, do their tasks, run a medicine review clinic, and then obviously do asthma to an annual clinic review level, and obviously do SMRs as well. So that's kind of where I am now. And then it's a case of then my plan now going forward would be to kind of become competent doing the clinics for for example, diabetes, HRT reviews, kind of pill checks, things like that. Then the next step obviously then would be doing minor ailments. So that would obviously then, but I would like to sort of have my base, my foundations ready before jumping to minor ailments, because that's such a big step up. So I don't want to kind of suddenly jump to minor ailments without having the competence in the other ones. So I think then that would just cause too much stress.
So I guess you are what we would describe as a level 3 pharmacist. I guess pharmacists can spend a long time at this level because there are so many different disease groups to look at, and there's so many different type of clinics that can be run at level 3. And I know you are currently undertaking your independent prescribing course, and at the end of that, hopefully you'll start to delve into the minor illness side of things, where you can diagnose and prescribe, and that's what we consider as a level 4 pharmacist, isn't it?
Yeah, so I mean, I'm very fortunate in my kind of experience independent prescribing course that my experience is doing some minor ailments under the guidance and review of my DNP. But yeah, so I'm certainly getting some initial experience, obviously the pandemic notwithstanding, but I'm certainly kind of getting a taste for what's required of a level 4 pharmacist. So taking a very thorough history, check medical history, allergies, everything that's involved, that checking for red flags, obviously very important. Then also then getting to know, depending on a person's age, gender, or then what presenting symptoms they have, what specific questions to then target, so you can kind of then start to develop a differential diagnosis, things like that. So obviously, this is where I think there's certainly the minor ailments is where you really start to almost diverge from a traditional pharmacist. So things that maybe we wouldn't have, like at university, they wouldn't have maybe thought we needed it, but like things like anatomy is a good example where obviously I feel like I don't have very much experience compared to a doctor, where they start talking almost in a different language, in terms of like they might start saying this is like a lateral epicondylitis, and then you're like, what's that?
I felt the same when I started doing minor illness clinics. The anatomy side of things is definitely we had to put a lot of energy to learn.
Sure,
yes, absolutely. Yeah, I felt the same. I went and got myself a huge anatomy book because, I'm not sure if I think a lot of pharmacists say that. I thought it was maybe just a university that we went to that we didn't really study anatomy. So I guess that's some advice for other pharmacists who are listening, who are looking to get into minor illness role. If your anatomy isn't strong and you haven't studied it at university, then that's definitely something that you're going to want to spend some time studying.
No, definitely just can't differentially diagnose or kind of rule things out if you don't know where certain body parts are. So if someone says they have chest pain and they point to a certain part, you need to know what's there.
Yeah, absolutely. So it's definitely, when it comes to a physical examination, anatomy is something that you need to know well. Well, Adrian, it's been an absolute pleasure talking to you today. We've touched upon some really interesting topics. So thank you so much for taking the time to speak to us. We wish you all the best for the future, and hopefully we'll have you join us again at some point.
Thank you so much for having me today. I really enjoyed it, and I'd be happy to come back anytime.
And for anyone who would like to get in touch with Adrian, we will put his contact details in the description. This podcast was brought to you by Clinical Pharmacist Academy, supporting pharmacists to transition into the general practice sector and accelerate their career as a clinical pharmacist. For more information about our academy, visit cpaweb.org.uk.